much, Kelsey. Time to talk about your health, everybody. This is Breast Cancer Awareness Month, so how can you possibly lower your risk of getting breast cancer? UAB nutritionist Dr. Beth Kitchin joins us with that answer. I meant to wear pink. I wore pink yesterday, but you know, of course, we had a lot of breaking news, obviously.
Right,
so,
exactly.
But you know, this is Breast Cancer Awareness Month. It's on everybody's minds right now.
It is, especially with actress Julia Louis-Dreyfus recently coming out with her diagnosis. So, right, the month, the actress, and everybody's thinking about it. And with breast cancer, Mike, we still have almost 41,000 women dying a year of breast cancer. Even though we're, you know, doctors and technology, we've gotten medical technology has gotten so much better at treating it. We still have a lot of deaths. The good news is that about 33% of the cases might be preventable through lifestyle changes.
And certainly one death is one too many, but let's look at the ways we can lower our breast cancer risk. Let's just start off, first of all, what can we do?
Well, the first tip is to get at a healthy weight and stay there. We know that about 1 in 5 cases of breast cancer is related to excess body fat. That body fat can increase inflammation, can increase certain hormones that then instigate or promote the cancer. So staying at a healthy weight, keeping body fat healthy is really important.
Well, I guess coinciding with that would be, you know, staying active. You know, and depending on how active are we talking about?
Exactly. We know that exercise seems to improve the immune system. You don't have to do a crazy amount of exercise, roughly 30 minutes a day, and it doesn't need to be incredibly intense. Exercise can be, you could go out gardening. There are actually some scientific interventions at UAB where they're looking at gardening as an intervention for women with breast cancer, helping them in a variety of ways. But also walking, dancing, swimming, whatever you like, get out and become physically active.
How much does, you know, consuming alcoholic beverages increase the risk?
Alcoholic beverages have an association with an increased risk of breast cancer, and it's pretty consistent across the studies. Now, that doesn't mean you have to give up all alcohol, but moderation is really the key here. Alcohol seems to act as a carcinogen, and it can damage the DNA, which is then a cause of the breast cancer. And so what we recommend is, for women, 1 alcoholic beverage a day or fewer on average. Now, that's sort of the same recommendation that we give with heart disease, but in the case of alcohol and cancer, less is generally best.
As we wrap up, what about the different diets out there? Does some of those help possibly prevent it?
There's some early data, and it has a ways to go, with the Mediterranean diet, particularly with the olive oil component of the Mediterranean diet. There's been a pretty good study, and again, it's just one study, so we can't go too crazy with this, that showed that including olive oil seemed to lower the risk of breast cancer. Now, here's the kicker to this. You got to get a lot of it, like 3 to 4 tablespoons a day. So that's a lot of olive oil, but start including that. We know that that's healthy, can't hurt. So let's hope that we can help to prevent some cases of breast cancer.
And definitely, if you're a smoker, try to quit smoking.
Absolutely.
Dr. Beth K, thank you.
Thanks a lot, Mike.
All right, Sharia.